Hi, my name's Arden, and today for my portfolio assignment, I'll be explaining the ways of knowing and how the ways of knowing affect the interactions between patients and the nurse who's giving the care. The ways of knowing that I chose that affect these relationships are aesthetic, ethical, and personal. I'll be using scenarios throughout my portfolio assignment to further show and expand my understanding of these ways of knowing. And I will first be using my mother, whose name is Nicole, and she will be talking about her personal experience in the hospital when going through treatment after surgery and how two different nurses have affected not only her physical health but also her mental health. This will expand, firstly, on the aesthetic ways of knowing.
Hello, my name is Nicole, and I have breast cancer, I had breast cancer. I don't have it anymore, thankfully. I just wanted to highlight my experiences with two of the nurses that provided care to me when I was in the hospital, getting a mastectomy with a full reconstruction and left breast reduction. The care that I received from the two nurses were very different, and actually are kind of important, and it was important to the care that I received and how I felt physically and mentally. And how I've realized how I rated my overall experience with the surgery and in the healthcare setting had solely to do with how the nurses treated me. It really wasn't how the doctors or surgeons treated me. It was really came down to the nurse, because it's the nurses that actually see you and provide the care for you, other than obviously the surgeon doing the surgery. But yeah, so the post-care with the nurses is so important for the patient. So coming out of surgery, I had a nurse that was more hands-off, not a hands-on nurse, not a very caring nurse, didn't show empathy. My first experience with her was, "What did you get done?" instead of her name. I was coming out of some heavy drugs at the time, so I was trying to get through to her what I got done, thinking in my head, why isn't this written down somewhere? Why is she asking me this? My husband isn't here yet to answer you. I'm trying to get the words out, but they're not quite clear enough. But I ended up getting it done, and she figured out what I was there for. And then I was thinking in my mind, boy, this maybe isn't going to go well after this. And I was right. It went downhill from there. Really lack of care, lack of medication, IV pump not working, and she knew that, not changing it out for the entire shift. We thought it was fixed. And so that was a huge downfall, I guess, in my care. I didn't progress well. When the new nurse came on, I was pretty much at stage 0. I really wasn't at all doing well. They ended up debriefing in front of my bed. So the new nurse coming on was being told from the nurse that was on duty what was done. And with me, the new nurse is asking, what pain level am I at? What pain meds am I on? What anti-nausea medications am I on? The nurse that was on duty could not answer those questions. So when the new nurse came into my area, she said, "I'm pretty sure you probably heard that." And I said, "Yes, I did." And she said, "I am so sorry. I don't have words, really." I remember her saying that. She's like, "I think we're starting from ground zero here, and we're just going to have to get you better." And she said her name. She looked me in the eye when she talked, and she said it's her mission to get me to feel better on her shift, and she's going to do it. And she apologized again, and she kept finding out all these things that weren't done, and she was shocked, and but very professional about it still. She said, "Well, we'll just move on from there. We're just going to keep looking upwards and onwards." So amazing nurse. In the end, I wasn't 100%, and I wasn't progressing as well as she wanted me to, so she advocated for me to stay overnight, which apparently is not really heard of these days, since mastectomies are considered day surgery now. Wasn't in the past, but things have changed. So I ended up staying overnight and was able to leave the next day. But when the second nurse that came on, I built a rapport with her. We actually built quite a little relationship in that short time. She was very sweet, very caring. We actually got along really well, and she didn't leave her shift without a hug from me. The care she provided me was night and day from the first nurse. She had a lot of knowledge behind her. She was getting her master's degree. A lot of knowledge behind her in anti-nausea medication. So that helped. But it really was her empathy and her ability to treat me like a human being that actually made me feel so much better. My confidence levels were higher, and I just overall had a more positive outlook on things than I did from the nurse that treated me prior.
When listening to Nicole's journey about her hospital experience and the aftercare she received, we can look at how the two different nurses have affected her, either negatively or positively. We can see that they both affected her physical health, her mental health, and her overall confidence. When looking at an article that talks about the ways of knowing as a framework for effective practice in nurses, we can see that the authors Campbell, as well as the other authors, explain that aesthetic way of knowing is about showing empathy to gain knowledge about an individual's experience and using creativity to formulate a response to their situation. So using creative work instead of just the normal nursing care that you can provide in order to make the patient feel more cared for and make them feel more special while being at the hospital and while going through difficult times. So, the aesthetic ways of knowing is so important because it goes beyond the surface of just the level of care, and it also takes the nurse to a more meaningful level with the patient. This can also be explained on the article I just talked about previously, where Campbell and other writers wrote this, and it can be found on page 4. We can also see that aesthetic ways of knowing improves the overall health, not just the physical health, but also the mental and confidence levels of the patients that are receiving this aesthetic care. What Nicole didn't touch up on, what she wanted me to add to this video, is that the nurse not only provided a better care than the first nurse, but she also provided a more creative way of caring for Nicole. She would sit down by her bed and listen to Nicole's stories about her family and how her daughter, me, is going into nursing school. The nurse would provide lots of feedback about what nursing school is like and talk about her nursing experiences in order for her mother, my mom, to pass on that information to me. She also did put on meditative music when my mother was not sleeping. This did provide also a little bit more of creative care, as some nurses didn't care to think about what Nicole or my mother would have liked when she was not sleeping. My mother often does enjoy a lot more meditative music, especially when she's stressed, so the nurse found this out and was able to put on this music at the right times. So as you can see, doing these things for Nicole very much increased her relationship with this nurse, as the nurse showed that she really did care about Nicole's stories and that she did care about what Nicole liked and what Nicole didn't like, and what she or how she was feeling during those times. So being able to use that creative care and being able to put in that empathetic care really increased the relationship between the nurse, the second nurse, and my mother. As you can see, the first nurse did not do neither of the things, so the relationship was just not built there. We can also relate Nicole's scenario to the ethical ways of knowing. Looking at the article that we've talked about previously, Campbell and other authors say that ethical way of knowing is using guides and directions on how nurses conduct their practice and what they view as important and what priorities require advocacy. Ethical knowing involves confronting and resolving conflicts, values, and norms. So, my mother's nurse also showed ethical ways of knowing, or ethical care, because she advocated for my mother to stay in the hospital when usually the norm is for people who go through those surgeries to leave as soon as they're done and after they're done being monitored. They usually do not stay overnight. This is also why the doctors wanted my mother to leave early and not stay overnight. However, the nurse went against these norms because my mother was not showing the same kind of physical health as the other people did when they left. So being able to know my mother and know her health and being able to know her own morals and the right and wrong, she was able to make this decision and advocate for my mother, which really does show that she knows how to ethically care for a patient and go against the policies that usually are inflicted. Because the nurse advocated for my mother, the relationship between these two people became even stronger. This is because she showed even more care and went above and beyond to go against the policies and the norms that are usually happening in this hospital to further care for my mother and to further show concern. We can also look at the CNA Code of Ethics, which explains that it is the nurse's responsibility to provide safe, compassionate, competent, and ethical care. And this can be found on page 9 of the CNA Code of Ethics. So we can see that Nicole's nurse did provide safe and compassionate care as she showed compassion for Nicole's situation. She also showed competent and ethical care as she was able to tell that Nicole was not able to leave the hospital because of still her physical conditions were not up to par. So she was competent in that area, and she also provided ethical care as she used her morals and knowing what's right in order to make sure that Nicole stays the night so that she can monitor her further. Here's another scenario that I have made up that will reflect personal ways of knowing the best way possible for the way that I would like to explain it. So this doesn't have any correlation or relation to my mother or my family, but it's just something that I made up to better show my understanding for the personal ways of knowing. Here's the last scenario. Two people come into the ER after being in a terrible accident. One is an 18-year-old girl, and one is her grandmother, who is an 85-year-old woman. Unfortunately, the patient's grandmother did not make it. After the patient is done receiving her care, her nurse decides that it is a good time to break the news. This leads to the patient to become in shock, in grief, and also experiencing a very big load of distress. Luckily, her nurse has been through a death of a loved one before, and because of this, the nurse is able to comfort her and is able to provide empathy as she can relate to this patient. After listening to the scenario, we can see that it's easier for the nurse to provide empathetic care because she has an ability to relate to this patient. This increases the relationship between the patient and the nurse. Imagine if she had a nurse that has not yet gone through severe amounts of guilt or the loss of a very close, loved family member yet. This may lead to the nurse not knowing what to do. When looking at the article that I have talked about previously about the ways of knowing and how it provides a fundamental framework for the reflective practice in nursing, we can see that Campbell and the other authors explain that it is through knowing oneself that they can know others. They also explain that it is further through personal knowledge that makes meaningful shared experiences possible. This is on page 5 of this article. This shows that it's so very important for the nurse in this scenario to remember how she felt when going through this grief, and how important it is to provide emotional support during this time, as a patient should never be going through this type of grief alone. Furthermore, in general, we can also talk about how it is a nurse's responsibility to reflect on their experiences in life so that they can further one day be able to use their experiences to help somebody else through grievances and other hard times. So, through all of this, we can see that using personal ways of knowing in your nursing practice can influence a very positive relationship between the nurse and the patient. By being able to reflect on your life, you can further help a patient when going through grievances or other traumas in order to help show that you relate to this patient, and relating to this patient can further increase your relationship. Before I close off, I would just like to say the reason why I picked these 3 things is because it reflects my personal values. By showing that oftentimes it is more important to care for the mental health of patients instead of just looking at their physical health. Although their physical health is very important, looking at their mental health and creating a relationship with these patients is what makes the job so much more important and makes the job so much more worthwhile, is being able to create a relationship and also being able to physically make these patients better and see them thrive. what I would do for aesthetical is just ask the patients what they may want and see what they most value, and put those into my practice when talking to them. Maybe decorating the room after having a birth, or getting over a disease, or adding their favorite color to their room, or adding teddy bears to a child's room. That can be something that is more aesthetic. For ethical, it did make me question myself quite a bit, and question, would I be able to stand up and advocate for a patient if there are certain policies that are going against this patient's wants or needs. And lately I've been thinking, yes, I probably will be able to do that, although it will take some nerves and it will take some practice. But it's also just making me further question my morals and what morals I see fit for myself. It also makes me understand that there are different biases and different ways of thinking, cultures, and religion in this world, and that I will not be able to push my bias on these people, because obviously we have to practice autonomy when going through our nursing practices, as it is the patient's decision through picking their best way of care. And also through personal, as it has made me realize that I do need to reflect more, not only on my schooling and later on my practicums, but I also need to reflect on my actual life experiences in order to fully help patients later on, because we're all human and we all go through certain hardships. And so being able to write down how I got through those, so I can further remember how I can help somebody else go through those, is what I would do in order to further help those patients. And that's why I think reflection is also so important in my morals as well. So that is some of my personal values on it, and it's made me more personally aware of what I need to start thinking about and what I already know about myself. In conclusion, the ways of knowing through aesthetic, ethical, and personal approaches can lead to a better relationship between the nurse and the patient, which can in turn cause a better effect on the well-being and health of the patient. The reason why I'm not including empirical ways of knowing today is because although it is important for a nurse to know how to properly medically care for a patient, it is important when it comes to relationships to look deeper into the patient's mental, emotional, and spiritual well-being instead of just looking at the physical data of why they're in the hospital in the first place. It is important to note that most often patients do not base their understanding of a good nurse on how good the nurse medically cared for them, but how good the relationship was between the nurse and the patient, and how the nurse made them feel. So the nurse could be doing everything right when looking at the medical ways of caring for that patient. But if they did those right things, but treated the patient as though they were just a project, this may lead the patient feeling even worse than they did when they came into the hospital mentally. So that is why it's so important to, yes, provide the right medical care, but also to really develop those relationships with the patients in order to fully make the patient feel more confident in themselves and leave physically, mentally, and spiritually well. Thank you so very much for listening to my presentation. I hope you really enjoyed it, and my references will be handed into you through a Word document that you will be able to receive along with this presentation. I hope you enjoyed it.